Hello everyone, my name is Haneen and today I will talk about tonsillitis. First, I will talk briefly about the tonsils and their function. Then, I will define tonsillitis and discuss the causes, the symptoms, and the treatment of that disease. So let's get started. Tonsils are lymph glands located in the back of the throat that are visible through the mouth. Tonsils are the immune system's first line of defense against bacteria and viruses that enter your mouth. This function may make the tonsils particularly susceptible to infection and inflammation. In this image, you can see the location of the tonsils and you can see the difference between the healthy tonsils and the inflamed tonsils. Tonsillitis, also described as pharyngitis, refers to inflammation of the pharyngeal tonsils. Most cases of tonsillitis are caused by infection with a common virus, but bacterial infections also may cause tonsillitis. Tonsillitis is common in children. Most children in the United States experience this condition frequently. Symptoms of tonsillitis include red swollen tonsils, sore throat, difficulty swallowing, and tender lymph nodes on the sides of the neck. Other symptoms may include fever, bad breath, headache, and stiff neck. Treatment for tonsillitis depends on the cause. If the cause is a virus, there is no medicine to treat it. If the cause is a bacterial infection, such as strep throat, the patient will need to take antibiotics, which help bacterial tonsillitis get better faster and prevent complications such as rheumatic fever. Common antibiotics used to treat tonsillitis include penicillins, cephalosporins, macrolides, and clindamycin. It's important to finish the antibiotics even if the patient feels better. If treatment stops too soon, some bacteria may survive and reinfect the tonsils. In certain situations, determined by ear, nose, and throat specialists, surgery may be recommended to remove the tonsils. Typically, children who have 7 episodes of tonsillitis in 1 year, or 5 episodes per year for 2 consecutive years, or 3 episodes per year for 3 consecutive years, are considered candidates for tonsillectomy. If a patient has a severe case of tonsillitis, peritonsillar abscess surgery may be needed to drain the abscess around the tonsil. People who experience chronic tonsillitis may start to experience obstructive sleep apnea. This happens when the airway swells and prevents a person from sleeping well. It's also possible the infection will worsen and spread to other areas of the body. There are some things you can do to feel better. Drink plenty of fluids. Try eating soft foods if it hurts to swallow. Try drinking warm liquids to soothe the throat. Get lots of rest. Sleep in a room with a humidifier. Gargle with salt water. Take an over-the-counter pain reliever such as acetaminophen. Children and teenagers should not take aspirin. Giving aspirin to children during viral illness like flu or chickenpox can lead potentially to a fatal condition called Reye's syndrome. It's defined by sudden brain damage and liver function problems. The viruses and bacteria that cause tonsillitis are contagious. Frequent hand washing can help prevent spreading or catching the infections. Wash your hands frequently, especially after using the toilet and after eating. Avoid sharing food, drinking glasses, water bottles, or utensils. Replace your toothbrush after being diagnosed with tonsillitis to prevent reinfection. Thank you.